So this is a quick demonstration of a standard smart EHR. As you can see on this screen, there are a number of patients that I already have on my smartphones. Initially, smartphone is very simple. There are a few fields like you can see here on the screen with allergies, drugs being used, appointments, and a few fields like that to make it very simple for the patients to start. But we can also add a number of additional sections as when we need to store more information. Like in this example, you see there are a few more sections in my health data for this Paula Adams description or demo record. On this screen, you see a number of allergies, mine, my family's allergies. I can also have a few blood tests and the results of those tests, which can appear in a structured format like here, which means that I can have evaluation of that parameter, but it can also be a simple PDF that has been sent to me by my lab or my hospital. That's for blood tests and other types of tests. Then we also have a number of documents that can be stored in the SEHR, both images like you see here. That's a radiography of my knee with the problem that I have. It can be all types of documents actually, PDFs or pictures that I take as a patient. Here is a test that I took and I wanted to have a recording of this in my health record so my doctors could see it. Another example here is what we call the logbook. That's a way for patients to enter various elements that will be necessary or useful later when I will see the doctor. Here you see the drug module with a number of drugs that I'm usually taking, and here I'm entering a new dosing for my drug, and also I will enter when I want reminders for this drug. So here I'm entering 1 tablet of Glivec that I want to start today and repeat every day. And I will also specify a time when I want a reminder. And this will repeat and tell me and remind me when I have to take my drugs. This is very useful, especially because we also register the times of input of a drug, which can also help us verify adherence in the future. So here you see that when tomorrow I will have this reminder, and when I take the drug tomorrow, I will click on that button to tell my health record to register in my health record that I took the drug. Voila, these are the main sections of a health record. Here you can see that I can receive various notifications, either for drugs or for documents being available at my hospital. This is the services screen, so this is where we can add a number of external services provided by partners. There's a lot of possibilities here, as you can see. And as a final note also, here we go to the languages setting, and you can see that this system is available in quite a few languages, European but also out of Europe languages. Voilà, that's the main part of this of showing what a health record here. Here you can see a timeline view to see what's new. Here you can see who I'm sharing my data with. So there's all kinds of features in that system that can be useful for a patient. Now let's look in more details what the InteropEHRate project brings to patients and other stakeholders. The following demo will focus on three main players, and we focus on a few problems that these stakeholders have. One, patients. They need access to their data, whether the data comes from hospitals, labs, family doctor, a nurse, or other healthcare professionals. They need to share their data with their healthcare professional, and some of them want to contribute to research so that we can find new treatments faster and cheaper. Healthcare providers, what they need is access to patients' data so they can provide good care. And they need also to send information back to patients, like prescriptions for drugs, prescriptions for other exams, drug schedule, the diagnostics, and all of these. And the third main category of players is the medical research. So both the industry, so pharma companies, medical device manufacturers, but also academia and hospitals that are doing research. For these stakeholders, it's important to collect rich data and also to recruit patients, which is a problem that is becoming more and more difficult. And of course, all of this needs to be done with a very high level of privacy. We call it the European level of privacy, because Europe is very strict on this. And we also need to take into account the new reality that patients want a control on their health, therefore a control on their health data. And so we really need to be patient-centric and not only talk about that, but really do something about it. So these are the problems that we address, and the following demo will focus on one set of, one scenario, if you want, the healthcare access. Both as a patient, I want to access my hospital, but also as a patient, I want to have a connection with my doctor, possibly in another country. The protocols from InteropEHRate, as you can see on this slide, also address emergency scenarios and research scenarios which will be demonstrated in other videos. Okay, for this healthcare access, the demonstration will be split into two parts. On the first part, on the left side, the patient will do a remote connection from his smartphone to some kind of central system or regional system or hospital. He's probably in his home country, and then he gets all of the information, a copy of that information back on his smartphone, and then he is free to move around. And then on the second part, to the right of this slide, we will demonstrate how a patient in another country, possibly another European country that also supports InteropEHRate, can locally connect, meaning without an internet connection. So in this case, Bluetooth connection with a doctor in that other country. These are the two parts of the demo that we will have, and always with a patient-centric approach, which it's worth noting we add to the top-down approach. So patient-centric is bottom-up, from the patients up the layers, like hospitals, regional networks, government levels. So most of the time the approaches are top-down, but we want to add a bottom-up approach without replacing the top-down. So here you see SEH app, donc smart healthcare, smart electronic health record running on a smartphone. In this case, it's the Andaman 7 existing application, which has been augmented with InteropEHRate protocols to show what can be done with those new protocols. So it's a reference implementation. Andaman 7 acts as a reference implementation of these protocols. There is one unique health record on this phone, Sam Thomas. As you can see, there is nothing in the appointments section, and if we go to the document section, it's also empty for the sake of the demonstration. Now we go with this patient. This patient goes in the services screen, which you can see down below. And in that screen of services, there's a number of them, but we will focus on the first one, which is a way for us to collect and to group all the InteropEHRate services. And we will demo some of them right now. So first, there is a warning about the European regulations on medical devices. And you can see in this screen a number of scenarios that are depicted by the green buttons at the bottom. We will start by importing the health record from my hospital. So here I have a list of, for example, 3 hospitals I usually work with, but I could also search through thousands of hospitals in Europe or maybe worldwide. and select the ones I want to connect to. So here I will select CHU Liège, a Belgian hospital, because I'm a Belgian patient. I will go via an authorization system that is provided here by the region or by the country. This is based on the European ADAS infrastructure, which is a large-scale infrastructure for authenticating citizen and managing access rights. So once I have connected to once I've been authenticated by this system, then I can select what I want to get a copy of. So this is everything that my hospital CHU Liège has about me. And I will here select the patient summary, but also 2 encounters, 2 consultations that I've had with some doctors in that hospital. I'm connecting directly to the server, which is sending me the data that will, so I will have a copy of that data locally on my phone. The data from these 3 sections are being downloaded, processed, and stored in the various fields that are existing in the mobile application, in this case Andaman 7. And we will go back into the health record of Sam Thomas, open it to show that there is new data that has been downloaded here. So the appointments, you can see that there are 2 visits, 2 appointments with a number of details about that appointment. And if we go in the test section, as you can see here, we have a number of lab test results that have been downloaded. And then we go in body measurement section, where there are a number of values also that have been downloaded from the hospital, and in the documents, finally, a document that is available here. The medications also downloaded from the hospitals can be displayed here and shown to the patient. So all of that is a lot of the information that, as you can see, has been downloaded from the hospital down to the local phone, and that is available to the patient locally, even when there is no internet connection for the patient. That was the first part of the demonstration, connecting to a remote hospital. Now this Belgian patient has their data on their phone, and he's going abroad in another country, for example Italy, and then he has a problem there, a health problem, and then he goes to hospital or to a family doctor, and we will see how we can connect to that doctor's software with a local connection, so not using internet, because you don't always have access to internet, and we will be using a Bluetooth connection here. So that same patient is going in his health record, he's in front of the doctor, he clicks on the sharing button and he starts a local sharing, as you can see in this screen. And to simplify the connection, what we will do here is scan a QR code. That QR code is displayed by the doctor's software. You will see that in another demonstration today about the healthcare professional application. And we build the system so that we can hide everything that is complex from the patient's view. So this includes technical information, that includes security information. There's actually a lot of information in that QR code that is automatically processed by the mobile of the patient, by the Andaman 7 or the SERAP in this case. And as you can see here, there is first a validation screen, some kind of a consent. So you see that the doctor's name is there, his profession, and a number of information to just make sure that the person you have in front of you is the one corresponding to what is being displayed here. So you, by continuing the screen, you give a consent, and the consent is that your information is shared from your phone to that doctor via a local connection. Once you agree and you give your consent, then the connection goes quite fast actually, and the information is sent to the doctor. Of course, the normal course of action is that the doctor will execute the consultation at this point and probably prescribe some drugs or additional exams, maybe write some kind of a diagnostic in the health record about you that he has, and this information should be sent back by the doctor to the patient also via that Bluetooth connection, so that as a patient I have the update to my health record with me, and when I come back home or when I have an internet connection, I can connect to my the hospital I usually go to, or to my family doctor at home, and send that new information provided by the doctor from Italy or from that other country I was visiting.